Now it's time for News Extra, brought to you by Gering Civic Center. And with our program, here's Kevin Mooney.
Thank you very much, Dennis. Good morning, everyone. Caryn Long is here. She's with the Nebraska Senior Health Information... let me get this out. Nebraska Senior Health Insurance Information Program.
It's a mouthful.
It is a mouthful. Look at all those initials.
Answering the phone is a trick.
Yeah. What do you say? Nebraska SHIIP.
Actually, when I answer the phone, I say, "Hello, this is Caryn with the Nebraska Senior Health Insurance Information Program."
Oh my God! And then you go, okay, and then hope the people haven't hung up by then.
Well, because if I say this is Caryn with SHIIP, they say, "What?
What are you doing?" Okay. But anyway, she is a very important person for anybody who's reaching the age of 65, looking at Medicare, or you have Medicare, or any other senior health insurance questions. She's the gal you go to. And we're going to talk today about new Medicare cards that are being mailed to residents here locally right now.
Right now. We've been educating Medicare beneficiaries since the 1st of January about the arrival of the new cards. Wave 1 and 2 have been completed in the nation, and we in Nebraska are in Wave 3, so the cards are arriving now.
Yeah, and these cards are totally different than what folks have had for years and years and years, and there's a reason.
Yes. Medicare is removing Social Security numbers from the Medicare cards, which is a good thing. Replacing them with a Medicare identifier, which is a series of numbers and letters, which will make it more secure for beneficiaries to carry with them.
Yeah. So you have no Social Security number on there. They don't even indicate what gender you are anymore.
No. That has been removed from the card, as well as the signature line. So no one can copy your signature by getting a hold of your Medicare card either. Seeing an example of your writing.
Yeah. These are good changes
Very good.
to get rid of at least start to get rid of some of the fraud and waste, and fraud especially that goes on with Medicare,
yes.
Right?
Medicare has worked very hard to curb the fraud, waste, and abuse. A lot of behind-the-scenes work has happened to make this come about. So please open all of your mail. Look for your new Medicare cards and don't confuse it with junk mail. This is a real official Medicare card.
Yep, and you need to have it. The doctors will want to see it.
Yes, the doctors are going to have a 19-month transition period to transition, so we make sure everybody gets their new cards correctly. If you don't get your new card by the end of July, I would be calling Social Security and find out, where is my card? Now, I didn't mention this on the FM side, but if you have a protective payee who is getting your mail for your Social Security and they live in a different state, that mailing will go to their address, possibly in a different wave of mailings. So that's something for seniors to consider here as well.
Oh, okay. So that's possible.
That's possible, yes.
Right?
Yes.
But otherwise, especially right now here in our area, these cards are being sent in Nebraska right now. They were sent to some other places earlier.
Right.
But right now it's happening here. You need to be looking.
It just started this week. We got a press release. They're arriving in Nebraska mailboxes now. And you should shred your old card when you get your new card.
Right. And like you say, the doctors are looking for these cards.
Yes, and it's taken a lot of preparation for providers to get ready for this as well, changing their billing processes. So this will be a learning experience for everyone, yes.
Yeah. How much fraud do you see? Lots, huh?
Actually, we have more fraud here than you would expect. I've talked to a lady in Kimball recently whose mother gave her Medicare number away over the phone to someone who ordered her a back brace that she didn't need. hounded her doctor for a prescription, and the daughter didn't find out till after the fact. So we work closely with the Attorney General's office to fight fraud here in our own community. But nationwide, this is a huge problem.
Yeah.
So removing the Social Security numbers is hopefully going to save Medicare dollars.
Yeah, we hope so. All right, we'll take a break and talk more right after this.
Let your wedding reception be a truly memorable celebration by holding it at the Gehring Civic Center's elegant, calm-free ballroom. Your planning will be helped by professional staff who are dedicated to your event. The meat shop will delight your food sense with traditional or ethnic menus. There are no room or service fees with food purchases. Call 436-6888 or visit GehringCivicCenter.com. The Gehring Civic Center, the center of it all.
Back on News Extra, we have Caryn Long here from the Nebraska Senior Health Insurance Information Program. And we talked once again about those new Medicare cards coming out. Make sure you're looking for them in the mail. They're coming out right now in Nebraska. Very important to get those cards. Shred your old card when you get them. These new cards don't have the Social Security number or your gender or even a place for your signature in an effort to kind of wipe out some fraud that's going on with Medicare. We know that's happening all around the country. Now, the other thing is Medicare Part D enrollment kind of sneaking up on us a little bit. Starts in October.
It comes quickly, actually. We're starting to prepare for enrollment events throughout the Panhandle, October 15th through December 7th. We strongly encourage people to compare Part D plans every year because these plans do change premiums, deductibles, and what drugs each plan covers. You don't want to be surprised in January to find out that an expensive drug you take isn't covered by your plan anymore.
Yeah, and then you got a real problem.
And then we have a problem.
Yeah, so kind of make sure you do that. Check out that open enrollment program October 15th through December 7th. There's still donut holes for people,
yes.
Isn't there?
The Medicare Part D component has a donut hole. You're going to co-share payment with your prescription drug plan for your drugs until you've spent $2,750. And then you go into what's called the donut hole or the gap in coverage. But I have good news for you, Kevin. We're hoping by 2019 that donut hole might be gone.
That'd be great.
Yeah. It was initially projected to be gone by 2020. But with a new law that was passed, it might be gone earlier. So we're keeping our fingers crossed that we might be done with the donut hole soon.
So we have to rely on Congress for this, right?
It was passed in a law enacted called SHIIP Reauthorization Act of 2015.
Okay.
So we're hoping that is actually going to be the case.
All right. Okay. Very good. Excuse me for my skepticism when I said Congress.
I know. Exactly.
Okay. All right. You need volunteers, right?
Yes. The Senior Health Insurance Information Program is solely relies on volunteer counselors throughout the nation, actually. And in the Panhandle, we have a strong need for volunteers in small counties, Sioux, Banner, Garden, Sheridan County. Box Butte, I could use a few more volunteers. Here, especially Box Butte, I could use a few more volunteers. Here in Scottsbluff County, we don't turn anyone away. Professionals and true volunteers are welcome to take a very extensive 2-day training, which I am completing day 2 of training today with 4 volunteers. So we do this annually, but it's good to get the word out so we have some new fish on the hook.
All right. Quickly give us the numbers they need to call if they want to volunteer.
308-765-5546 or 1-800-234-7119.
All right. If you can't remember those, you can give us a call. We're probably going to do a story on this as well. And you can also visit Caryn. She's easy to find in the State Farm Insurance Building across from Walmart.
Yes.
All right. Very good. Thank
you, Kevin.
Thank you very much. Caryn Long, we appreciate her coming in.